This is part 3 of our case titled Chronic Low Back Pain with Sacroiliac Joint Dysfunction in a Hypermobile 21-year-old male. This is Jerry Hesch from the Hesch Institute in Henderson, Nevada, and we have a clinic. Website is heschinstitute.com. We do consultation and treatment for chronic pain, especially joint pain throughout the body, including the sacroiliac joint and lumbopelvic hip complex, and we also teach workshops to hands-on clinicians. This is the MRI, and when I reviewed this with Robert, I made the comment that in the first image that captures the sacroiliac, it appears a little bit different on this side. There's normative congruency across the top of the sacrum, midline bony structure being sacrum, and then this being ilium. And on the right side, looks like there might be a little bit of altered integrity. Continuity. And I think that when he was lying on the table for the MRI, he was lying somewhat asymmetrically. Could have been tightness in hip muscles on one side. They're not able to perfectly align the body on the table and make sure that every slice is perpendicular. So we need to take that into consideration. But it does appear that there's a narrow joint space on this side, and on this side it appears to be wider, and the space behind the joint also appears greater on the right side. Just to orient, this is the front of the sacrum, okay? This is the back of the ilium, so this would be near the region of the PSIS. And I'm going to arrow forward through a couple of these images. Now again, he probably was not laying symmetrical, so we do need to be cautious in how we interpret it. And on this side, you can see the dark line in the joint space. And this is the space behind the joint, and on this side, not sure that I can appreciate much difference behind the joint, but at the level of the SI joint on the right, there is more space there. In the third image, it remains quite dramatic at the level of the joint. Certainly more space here. Normative width of the SI joint in a young male would be 2 millimeters, and I certainly believe that we can appreciate almost 4 millimeters or so on that right SI joint. I said my laser pointer, but it's in shipment. And here, of course, is the left SIJ. And again, here's the right. Okay? All of this space back here is behind the joint space. Retroarticular ligaments. And we'll look at one more image. And so we're very cautious in how we interpret. We're not saying this is absolute proof. We're just saying that this appears to support what we found with the hands-on evaluation, which was that there was greater mobility on the right side. And here is his left joint space. And here is the right side. And it certainly looks to be greater on that right side. Again, he most likely had these images taken at a slight angle, so we have to be very cautious in how we interpret that. Part of the proof that in fact happened was that you can see the outline of this muscle mass here, which is the psoas muscle, if I'm correct, has some asymmetry, and at this level you're appreciating part of the sacrum here and part of it here perhaps, and this is a lumbar facet. So we're getting above, almost leaving the pelvis superiorly. In the very next image, you see less of the sacrum here, A little bit here, a little small amount here. That joint space still looks wider, and if we go up 1 or 2 more, I think we will exit. Right, now you can't see any sacrum, and you see the transverse process of L5. That would be the facet joint of L5, that's spinal cord there. All right, so I'm going to stop here. That is my point, being that it appears like the right side is a little bit wider, but again, you have to interpret it very cautiously. Thank you.